Welcome back. May is Physiotherapist Month, and joining us today to talk about what physiotherapists do is Patti Takeuchi, who works at the Welcome Back Pain Management Center. It's great to have you here.
Thanks for inviting me.
Yes. So this is a month to lend some awareness about this specialty. Maybe we can just start by talking a little bit about your trade. What exactly do physiotherapists do? I think when we think of a physiotherapist, it's about stretching muscles and getting things stronger.
Yeah, so we cover a wide area. When we're trained to be a physiotherapist, you have to go to university for 6 years, and it's a master's program now. So we're trained kind of in 3 different areas: cardiorespiratory, neurology, and orthopedic. And most people think of the orthopedic side of it when they come to an outpatient clinic, because they usually are coming because they have pain somewhere. Low back pain or shoulder pain, or they've had an injury. But there's a lot, you can come to a physiotherapist for a lot of different reasons. If we see stroke patients, people who've had spinal cord injuries, it's a wide area. So if you're having trouble with anything that's causing you to have problems with your activities of daily living, or you're having pain when you're doing something, then you can come and see a physiotherapist. And
how does a person with a stroke benefit from a physiotherapist?
Well, they're first seen in the hospital, usually, and they're usually been in the hospital for a while, and a physiotherapist will teach a stroke patient how to relearn movement. So there's all kinds of things. We try to keep their range of motion, because they often get tight muscles. They also have weakness in certain areas. There's different types of strokes, so it affects the way that they think too. So we have to teach them how to move again, how to walk. And it takes a while, but people can have changes after they've had a stroke for quite a while. So even if they're a year out, they can still improve.
Oftentimes when people have aches and pains, they'll say, oh, I need to either see a physiotherapist or a massage therapist. But those are 2 very different areas, or
yeah,
no?
They're different, but we complement each other. Like, I work at Welcome Back, and Teresa's my counterpart. She's the massage therapist there, so we have different training. But there is some overlap. In physiotherapy, you learn a little bit of massage, but I'm certainly not as good as Teresa. And then in terms of a physiotherapist will use different modalities. We can use ultrasound or laser, acupuncture. Massage therapists can learn how to do acupuncture too. So there is a wee bit of overlap, but there is difference in training.
Okay. You don't need a doctor's referral either. Some people might think you do need to go to your GP first.
Yes, a lot of people do. So then they wait and they put up with things, and I've seen that time and time again, where people are not walking very well, and then they get into, abnormal gait, and then they get pain in their back, or pain in their knee, pain in their hip. So they wait a little while, and when they come, yes, they don't need a referral to see us. We're primary care practitioners, so if you're having problems, you can just go and find a physiotherapist. And actually, there's a new app that you can use on your phone or your computer. It's called Find a Physio, and that's through our BC Association. They've set that up.
What can somebody expect upon their first visit to you?
When they first come in, it usually takes about an hour, and I'll do a full assessment, take a history, find out your past medical history. And then the assessment involves looking at the way that you walk, looking at your posture, testing your muscles, your reflexes, and then there's special tests, feeling, of course, too, feeling your bones and your muscles, and also asking the patient, what are your goals? Like, why are you here? And what are your goals? Like, someone may say, I want to be able to be able to play golf without having any pain, or I just want to be able to get in and out of bed without having pain. So it's patient-centered, but then I'll also say, okay, this is what I think your problems are, and this is what I think we need to work on.
Right. And it's not a quick fix thing. You're not coming in and having one session and you're fixed and good to go. People need to realize this is going to be sort of a continual thing as you go. Yeah,
depending on the problem. Some people need to come in maybe 3 times a week or twice a week. Some people live out of town, so they can only come in maybe once a week. But a key part of the treatment is getting them set up on an exercise program that they have to follow. So people will they'll come back, the patient will come back, and we'll go through their exercises, make sure they're doing them properly, and then reassess and progress. Progression is very important. Make things hard enough.
Exercise is key. Stretching is key, I'm sure, as well.
Too. Yes, yeah.
We have some posters that we can air, and some of them are recapping what we've talked about here. Yeah, basically, exercising and stretching is huge. We can go on to the next one here. interesting to note, of course, muscle mass starts to decrease in our 30s. Some people might think it's later than that, Patti, but the 30s, that's not when you're very old.
No, it isn't. Yeah, your muscle mass starts to decrease just when you're 30, and then if you end up on bed rest, like people who are in the hospital, it's exponential too. So people who've had a hospital stay will go home and they'll find that they're really weak.
Is that right?
And that's why it's so important for the physiotherapist to see them in the hospital. But then oftentimes when people come home after their hip operation or having a knee replacement, they'll come to me and I'll progress them and get them walking and doing a lot more vigorous exercise so that they can get back to what they want to do quicker.
Absolutely. All right, I think that we are pretty much finished here, but if there's anything else you would like to add about the Welcome Back Center, please do add it.
Okay, well, we're down at Columbia and 5th, and you can come in and make an appointment. You can call, and you can find me on Find a Physio, and you can also look at bcphysio.org for tips about lots of different things, back pain, shoulder pain. And tonight there is, I want to make a little plug tonight, there's a walk in MacArthur Park, and it's called Walk with Your Doc. So it was started by the doctors of BC, but this year the BC physiotherapists are joining. So we will be there too, and we'll be walking around MacArthur Park, and if you can enroll online, look up Walk with Your Doc, you can get a free pedometer.
Nice.
Okay.
And then count every step you take.
Yes.
All right, Patti, thank you for being here.
Thank you.
Very welcome. We will take a quick break. We'll be right back. Stay with us.